Could you just tell us briefly what your role was that day?
I was the supervisor of the department.
Of the what department?
Emergency department.
Where were you when the president came in?
Standing in the middle of surgery emergency room.
In the same room that he was wheeled into, you mean? Or?
I directed him to be wheeled into the room that he was in.
Did you go out to the car to meet him? Or
no.
You were waiting inside the room when he arrived?
See, the emergency room is set up that it has a big area called surgery, and he was taken to the surgical area of the emergency room and placed in trauma room 1 within that area.
And you were in trauma room 1?
In and out.
He was there approximately 20 minutes. Out of that time, what time do you estimate you were in the room also?
I had many other functions, but I was in and out frequently to make sure that they didn't need anything or didn't want anything or didn't need additional physicians or anything in the room.
Were you at any particular station around the body, any particular place, or were you all around the room? I was thinking about, whether you were close to his head or whether you were at his feet or...
Well, when he came in, I was close to his head. When he went out, I was close to his feet frequently because his feet were at the doorway.
Did you take is there any time in which you actually just sort of looked at the situation, your own impression of what sort of shape he was in and what condition he was in, what he looked like?
When he rolled in the door, I looked at him because I was responsible for seeing that the correct doctors got to treat the patients with the different types of wounds. Like when Tommy came in, I ripped his shirt open. I saw he had a chest injury, so when a chest doctor came in, I put him in his room. Whereas when a neurosurgeon came down, I put him in Kennedy's room.
So did you get a good look at the wound in his head then, or wounds?
Fairly good look.
Would you be willing, I have a accurate model of the skull with me. I was wondering whether you'd be willing to draw on it.
I don't remember exactly how much of it was blown off, but some of it was missing.
Would you be willing to try to do a drawing?
You just draw generally what you observed?
The right-hand side, right along the middle.
Part of the problem of the computer is obviously is that, people gave oral descriptions, and then someone tried to figure out what that meant by drawing pictures, and there's been a great deal of confusion over the years. What we'd like to do is get you to draw it here, and we're asking that of other people as well. If when we've got all these drawings and we're doing photographing, there seems to be a serious discrepancy, then we've got a lot more work to do. If it doesn't, then we're going to pack up our bags and go home. But would you be willing to just try to draw what you remember on this pen?
Brought the skull.
It's only plastic. Like that. No bigger than that. That's somewhat smaller than some of the others.
Oh, it would be bigger on a human.
That is supposed to be life size.
Yeah, I was bigger than that.
Could you draw it again? Maybe should we erase that? No, the president when he came in, or with Pat Hutton and Diana Bowron?
No, they did not go out. The president was brought in by the doctors that were on duty in the OB-GYN emergency room. There was no nurses that went out on the doctor when the president.
No nurses went outside by the car. That's what they testified to for the Bowron position.
Not that I'm aware of.
By the way, do you know where Diana Bowron is today?
She might have gone back to England. She was an English nurse.
Did she leave shortly after the assassination?
No, she's been here. She stayed here for some time after that. I don't know where she is.
Was the president lying on his back and with on the back of his head the whole time on each occasion when you saw him? You never saw him when he had a position like lying on his side or his head on one side or one thing like that. So it wasn't there was no way you could have had a clear view certainly of anything directly back here. But you could have seen anything on presumably either side on the top.
Oh, I did see it when we wrapped him up and put him in the coffin. I saw his whole head.
You saw his whole head.
Mm-hmm.
Did you see anything in addition to this in the back of his head?
Mm-hmm.
Not even the small bullet wound that they found at the autopsy that just wasn't apparent. There's hair, presumably, or something like that. Is that still accurate now, that dark line as to what you drew?
I like that.
You like it?
It's about like it.
About like it, okay.
It's been 17 years ago. You realize that? I should let the poor guy die and leave him alone.
Mrs. Nelson, I want to show you now a picture
Okay.
on page 104 of the House Assassination Committee report. This rear view of the head, that is a photograph taken of the president's head during the autopsy. I should say it's not a photograph, it's a tracing, a drawing, which claims to be an exact replica of the rear of the president's head after he was shot.
It's not true.
It's not true?
Mm-mm.
That could not be.
Not unless they pull all that skin back down, but some of his head was blown away and his brains were falling out on his stretcher.
So, can you be more specific? Are you saying that this photograph does not show the wounds that you saw?
No.
And how doesn't it exactly?
Because there was no hair. There wasn't even hair back there. It was blown away.
How far back would you say, from what you could see, was the hair missing in this picture?
All that area was blown out.
And was there any loose flap of
There
skin
might have
or
been,
scalp?
but, you know, most of it there was exposed brain.
Uh-huh.
And there wasn't any hair. You didn't
And there was
see all
brain
that.
actually coming out of the wound?
I haven't seen all those pictures. All you got is a bullet hole back there? The Warren Commission even asked me if I saved any of his brains. And do you see any way you could get any brains out of that picture?
Well, there
No,
could be.
sorry. This is the picture you're referring to, right?
Yeah.
There presumably there'd be a hole here on the right side where that flap is, a large hole.
There was a large hole, but it was right back there.
Further back than that shows.
No.
So there's no way that those two could be compatible.
Not from what I saw.
Do you have any explanation? Do you recall seeing a bullet hole up in the cowlick area where they show it here? You're saying no? I just remember we're taping here. It's not going to pick up your nod of the head.
Oh, no, I don't remember seeing a bullet hole. All I saw was a bunch of missing skull and brains.
Is it possible that this bullet hole could have been obscured underneath hair and another bloody mass?
There's a possibility because he was bleeding profusely from that area.
Mm-hmm.
As you looked at it, were the borders of the wound very distinct, or were they obscured in any way, either by the brain tissue or blood or whatever?
They were fairly distinct, the ones I saw.
They were fairly distinct, all along, on all margins of that wound.
You talked to Dr. Kemp Clark about this?
Not yet, no.
You do have a call into
Can I show you another drawing here? This is a drawing that was made that appeared in a book called 6 Seconds in Dallas. Are you familiar with that book?
No, I haven't.
It's a drawing based on a description given by Dr. McClellan of the head wounds to the Warren Commission, and he placed it in the right occipital area, I believe slightly lower than you've drawn it here. This is that drawing that I'm showing you now.
This where it's got a flap, this is the whole area?
That's a hole.
Yeah.
How would that square with your recollection?
I thought it was a little bit higher up.
Other than that,
It was in the same area, but it was higher up.
higher up, but that far back on the head?
No, higher up on the head. Up a little higher.
But as opposed to being around on the side, it was in the back the way
No,
that
it was on the
indicates.
right-hand side.
Yeah,
Higher up.
okay.
But still occipital.
Yeah, back in this area.
Not as opposed to parietal, up higher on the side of the head. You place it more towards the rear of the head.
It was right there.
You're indicating the right rear of your head, right?
Yeah, right in that area. That's the right rear. Didn't I draw the right rear?
Is it
See,
standard?
this is a flap that they must have brought back down or something, because that was all neat.
From that angle.
Showing you now another drawing done by a Dr. Latimer, who also has had an interest in this case and has written a book. This is his schematic drawing of the wounds at the head.
How did he know? He didn't see the head.
He had access to the autopsy photographs and x-rays. He did drawings apparently both before and after seeing the autopsy photographs.
There was no bullet that I saw coming out the front of the head.
So the wound, no wound you saw when it's far forward.
No, forward.
Well, is it possible that we could have been talking about a
I
wound
think he was
going...
shot from the side and it went like this and just blew off the back of his head.
The glancing blow, a tangential blow like that.
Would it be possible that he could have... All right.
There
Well,
was
isn't
no
that,
wound in the front of his head.
isn't that what this could show also, shooting from the side and coming out a glancing blow?
There was no wound in the front of his head.
She said there's nothing that far forward.
I see.
That goes up almost to...
So you would disagree with this Latimer drawing? Yes?
Yes.
Showing you now just a drawing of a
This is the back part
skull.
of the head.
Could you draw the same thing on paper where you did on the skull, please? Here, use the pen.
The back of the head.
In terms of emergency procedure, is it standard practice at all to x-ray patients when they come in the emergency room?
If there's time to x-ray them, if they don't die before you get them x-rayed, and we don't x-ray them unless, if they die before they're x-rayed, we don't, before we have time to x-ray them.
So if it's an immediate life-threatening situation, you don't bother with the x-rays,
No.
right? And in this case, no x-rays were taken before he died. What about that other nurse named Margaret Hinchliffe? She also testified at the commission. Do you know what's become of her?
No, the last time I heard she was at Palo Alto in Stanford University, but I don't know where she's at now.
She's left there, you're sure?
Yeah, I'm not sure, but I think she has.
How long ago was that that she knew she was last there?
I called Stanford. They had no one to test her.
Probably a good one. There's a director of nurses out at Irving Community named Nancy Watt that might know where she is. Because she might be an active alumni member, and if she is, Nancy has all the addresses of the alumni.
Irving Community Hospital here in Texas?
Yeah. Nancy Watt, who's director of nurses. Call Nancy. Turn off your recorder.
Okay, that concludes, right?
Yeah,
This concludes the interview with Mrs. Nelson. Thank you.